Hello, everyone. Welcome back to our now fourth episode. Excuse the error on the previous card. The fourth episode of The Power of Dialogue. We are joined by everyone here today. So we have Tom, who has been experiencing issues with his. So do apologise for his appeared ventriloquism. We have Ryan, and we have George. So right off the bat, shall we start talking about what's been happening lately with COVID-19?
Yeah. So first off, COVID-19. Well, firstly, Boris Johnson's out of hospital now, which is a good thing. He's clearly getting better, and I think he's gone to Chequers to complete his recovery, which I think is a good move. I think throwing him straight back into the top job would have been probably.
I don't think he'd be able to handle it.
Yeah, I don't think he would have been able to handle it, and it would have been quite demoralising for the country to. If he's still, ill, to see him.
Is he the only leader to have actually contracted it in Europe, at least? I believe so.
I think so. I mean, Michel Barnier got it, but he isn't a leader. He's just
in Europe, possibly, but the Canadian Prime Minister Justin Trudeau, he definitely was self-isolating because his wife had it or had symptoms. I'm not sure if he had symptoms.
I think Bolsonaro in Brazil had it, but he's fine now. But I think he had it for a little bit.
Bolsonaro in Brazil. I mean,
what a catastrophe!
Seemingly, everyone in Brazil is going to get it at some point. It's going to be.
Yeah, I mean, have you heard his statements about what he said?
It's unbelievable. You say something about like it raining and some people will drown. And
I think, I mean, this isn't an exact quote, but I think kind of it was pretty much sometimes it rains and sometimes people drown in that rain.
Crazy.
I don't think people need to drown when it rains. If you get them to stand on the top of a hill, they'll be fine.
Exactly.
If the Brazilian approach is let them drown, then I'm worried.
Or build a massive ark and lead the animals in it 2 by 2. That worked as well. So,
well, it would just abandon the country.
Yeah. But for us, it's been a fairly mixed week of reports. So we've had there's signs that the death rate is starting to level off. However, it's been quite a bad week in terms of we've hit over 10,000 deaths. We were up near 1,000 deaths a day last week. There's been a lot more deaths of NHS nurses and doctors, as well as people in social care work, and that's led to a lot of criticism of the government in terms of supplying PPE.
Yeah. The PPE seems to be a lot of the focus of the news currently, actually, I seem to find. I think that we seem to be talking almost less about the virus nowadays and more about the PPE.
Yeah, well, it's really important because when you're in a hospital like that, you don't want, because obviously there's still people who are ill with other things other than COVID-19. You don't want nurses or doctors on a COVID-19 ward to then spread that around the hospital to people who are sick, who are more likely to who are more susceptible and vulnerable to the disease. But also the nurses and doctors themselves without PPE are left entirely unprotected from the virus, which is just unacceptable, really.
Yeah. Other more positive news for Europe, Spain and Italy seem to be slowly opening a few more shops, which is looking promising, considering we're, 2 weeks behind, approximately?
Well, I think we would be 2 weeks behind, but it is looking like we're going to have one of the the highest death tolls within Europe.
I think
And
we're 2 weeks behind the peak, but our peak will be higher in
Yeah.
terms of everything.
which is almost completely unacceptable, given that Italy were in that state first. They were the first ones in Europe, and we were told we're 2 weeks behind Italy, and because of inaction within government, we're now going to have far more deaths than many other countries in Europe, even though it was completely avoidable.
And if you think back, it's not that long ago, the lack of clarity that essentially Boris went and said that all pubs, bars, theatres should shut. It didn't order them shut, and it was just only advice that people shouldn't visit them. So so many stayed open because of unclear advice. When
And yeah,
later
you'd think though that when people hear the Prime Minister going, considering it's almost like almost the lifeblood of Britain, the pub. You think if the Prime Minister of Britain is going, guys, don't go to pubs, the pubs would get the message.
Yeah, but the problem about it though is because he didn't order them to close, pubs couldn't claim on business insurance, which they need to keep themselves afloat. So a lot of pubs basically face the option of either we close and we will probably not, we won't make any money, and we could lose the business, or we stay open and try and get people to come so that we can financially support ourselves.
Yeah, mind you, we can see the flip side of that with JD Wetherspoons.
Yeah, that's true.
I believe he's still refusing to furlough his workers and pay them.
Yeah, Weatherspoons is an interesting one because it's such a big chain of pubs, but the owner is in you could say all he's doing is it's good business, but it completely ignores the impact on workers.
Well, I don't think it is good business, honestly, because I think he's bringing himself down in public estimation, and he's effectively losing himself more money in the long run, I'd say.
But realistically, are you still going to go to Weatherspoons after this is over? You see people on Facebook.
But what my first pub I'm going to go back to is.
I disagree with Stephen. Not that it will be the first, but I will visit Weatherspoons again, even if he has. I'm sorry, guys. Even if he's been quite bad with staff and the landlords, he's just said he's not going to pay them, and it's their problem. That he has no care for anyone else means he keeps his costs down and makes cheap, very nice burgers. I mean, I need to declare that I have not been endorsed at any point.
Other pub burgers are available.
Yeah.
Um,
They're just not as nice.
Yeah.
Certainly, the thing about it is, it's just because it's so accessible. Weatherspoons, it doesn't have a monopoly on pubs, but it certainly has a sort of, on that style of pub, sort of pub that does quick food, sort of burger style. It's because a lot of other independent pubs, they can't, because they're not as big, they can't invest financially in their pubs the way that Weatherspoons can. But their Weatherspoons are choosing not to do so so that they can. I'm assuming so that they can try and lose as little money as possible, so that they can then invest that in maintaining their monopoly.
Yeah. I'm not convinced it's going to work out in the long run for him, because I do think that at least the other pubs have government aid packages and things like that, and they're not having that money. Like Weatherspoons having no money coming in, at least these other pubs are having money coming in.
Yeah.
That they're going to be eating into their accounts pretty quickly. I think Weatherspoons, once this is all open back up again, because they're going to need to rehire everyone. Plus, if they then fire people, then they've also got to pay severance packages. I think it could actually be quite messy.
I don't think that.
I'm not saying Weatherspoons will go bust.
I think that
Saying
lots
that
of
I
their
reckon-
staff will go back because in a world with some firms are shutting, even with what the government's trying.
Yeah, but they
But
need to
they'll
be
have
hired
the
as a new
workers.
employee. They don't go back to their old job, so they still Wetherspoon still need to pay severance packages, and they need to rehire them.
I don't think he intends on paying anyone a severance package.
No, if you're fired, you have to have a severance package of sorts, I believe.
Yeah, but I'm sure he'll find a way out of it.
The real question is he firing people now,
Or just not
and then is he
scheduling
going
them
to
out.
is he just not giving them hours?
I think we're
Because
going to have to see. I mean, I don't work for Wetherspoons. I won't be able to say, and none of us do. I think it's going to be
Yeah.
hard to know what the internal workings of that is going to be.
That is
I
true.
do think
I feel like
spent far too long focusing on burgers.
yeah, they might have drifted away from
Yeah. Just one last kind of thing, just to kind of catch up in coronavirus just around the world, is the mass graves in America.
In New
Yeah.
York specifically,
In
on
New York,
Hart
yeah.
Island.
It's really quite shocking.
Yeah.
I think that America has had a slower and worse response than we have, and I think not New York individually. I think the governor of New York has done the best he possibly can given the current
Yeah.
circumstances and current administration. But I think that America's is gonna be one of the worst affected countries for this, given the
I mean, it already is.
population. Yeah, it is. I think they're gonna it's gonna start getting really bad for them. I think it's almost it's very difficult to see how Trump can, if it's reported on well, how Trump can spin this, because
Yeah. So, what was our next topic for this one then?
Exit strategy was
yeah.
that we have restrictions in place, but the thing on the Horizons, BBC Horizons evidence, they were saying to stop the widespread spread of this disease, to achieve herd immunity, 2/3 of people need to be immune. There are two ways to be immune: to contract the virus and survive, or to have a vaccine, and that is the only two options in the long term.
Let's just talk about that herd immunity figure though for a minute, because that is actually surprisingly low.
Yes,
herd immunity
I don't
figures
think it's
are
for Yeah, I think we aim for 95% for measles, mumps, and rubella.
Yeah.
I think it's because of how long you're infectious for, and slash that's not aiming for complete eradication. That's just to stop widespread outbreaks.
Yeah.
I think that aiming for herd immunity is something that at the minute won't allow us to to sort of come out of this lockdown period. I think the only way that we're going to come out of this lockdown period that doesn't mean 2/3 of the country getting infected and recovering, or waiting for a vaccine, which could be there's been
It could never
reports that it
happen.
could be 6 months away, 18 months away. It's
6 months at the earliest, but there are diseases and viruses we don't have vaccines to. Is the sad truth.
And then after that, if we do have a vaccine, then we've got to think about the rollout of the vaccine, how we're going to do that.
Anti-vax.
And so yeah, and so I think the only way that we can get out of this lockdown quickly is if we have mass testing. And at the minute, it doesn't look like the government is doing anywhere near enough to get the amount of tests done.
I mean,
that is
I think it's hard to say. I do think they are trying to get those tests up. I do think it's also incredibly hard due to there's a massive global demand for them.
I think the testing situation is quite phenomenal in that I think it is, as kind of George said, the only way we're going to get out of the lockdown situation. But if you compare to countries like Germany, obviously the comparisons aren't exact, but the amount of testing they're doing compared to what we're doing is phenomenal. And I think we are making a lot of these tests, but they're just I don't know whether it's something to do with the bureaucracy of the NHS. I know in Germany it's slightly easier because there's more localized control of health systems, which has kind of sped up the response a little bit. But I think we're going to need to massively invest and have that as a key focus, kind of rolling out the testing over the next few weeks and months.
Yeah, I mean,
Yeah.
they are increasing testing numbers though. You know, it's not kind of standing still. They are slowly managing to get there.
I think at the rate at which it's increasing, it'd be getting on months before the lockdown ends. I think even if they're the 100,000 target by the end of the month, I think the consensus is that most people think it's quite optimistic. But I think even if we were to achieve that, if we were to test the amount of the population that we would need to be able to seriously start opening up the country again, I think even then we're kind of going to be in this for the long haul if we don't really step things up more than they have been already.
Yeah, there was a Guardian article yesterday that was published that says that the government is insisting that they're still on track for 100,000 tests by the end of this month, but the amount of tests that they're currently carrying out a day is actually under a fifth of that, which is 18,000 a day.
But lots
we're about halfway through the month.
To increase testing capacity, as the current tests, not antigen tests to tell you if you're infected, take a long time and lots of work to actually carry out to do and stick them in swabs and shake them around or whatever, and that it's developing new antigen tests, not antibody tests, that just take less time to do. So if there is a new test developed that could be made easily and carried out quicker, they could scale up quite quickly. It's just the current tests, making more of them isn't the point. It's that they're not struggling to swab people's mouths or make them. It's they need scientists in labs with high-tech equipment to actually tell you whether you're positive or not. There are only so many labs in the UK. You can't build a new lab.
Yeah. Well, you'd think with the amount of universities though who have high state-of-the-art labs that are far more.
But they're using most universities as well as private facilities, NHS
Well, I think
hospitals.
I think it's been the current situation where there's a lack of hospitals, a lack of ability to scale up testing because of infrastructure. Is just it's a damning verdict on the Conservatives' last 10 years in power, because the amount of money that they cut from the NHS when they were while they've been in government is now coming back to bite them.
Yeah, I mean certainly, but on the flip side of it, you have to think that they've also been voted in consistently. You know, I don't think it's. I don't.
Not the strongest argument, but
no. I'm not. I'm also saying that there's obviously enough there, and
hindsight is 2020. I think we can agree.
I think one of our issues is that we're not providing enough incentives for people to become nurses and things like that.
Well, I think it's very difficult to incentivize people to become nurses. If they don't want to become nurses, but also if we don't have affordable university fees, or if people because it's also about perception of universities.
That's what I'm talking about with incentivize. I'm proposing knock money off the university fees and things like that. We managed to achieve it with STEM. We managed to achieve it in getting a lot more people involved with STEM. It's just moving to a different focus with that.
With nurses, they used to, in the past, nurses and other allied health professionals received a £5,000 a year bursary to study at UK universities, which was removed under the Conservative government about 4 or 5 years ago, and is now being reintroduced for students starting this year. So yes, I'm aware, as my sister is an allied health professional who studied her entire degree without any government funding.
Yeah, I think it's just a ridiculous idea to take away that incentive, which has now been thankfully placed back, because otherwise you're just not going to get people wanting to study medicine, nursing, because it's too expensive, or they can't, they won't be able to make up the funds, and that means that we'll get a sort of, you won't be able to have, you can expand the amount of people that can take medicine and nursing if you give them these incentives.
Yeah, I think that these are things that definitely should have been re-looked at. I think that I don't know the figures of the numbers of the nurses and people who are in these environments at the time.
Yeah. I mean, one thing with the current situation is it's high pressure on Matt Hancock, who's currently the health secretary through all of this, and I think testing is going to be the biggest challenge for him still, and I think unless he hits the 100,000 target, he's going to be under a lot of pressure from the rest of the government.
We put so much value on government targets. Does anyone know what the annual net migration target has been for the last however many years that Theresa May introduced? I think it's to the tens of thousands. We've been nowhere in that order of magnitude ever.
Yeah.
I think saying that someone has to lose their job because they made up a ridiculous target is...
Yeah, but it's not a ridiculous target. It's a fairly doable target, like many other countries in Europe.
Then.
Well, for not hitting the target, if you make a promise in government, then you should be held accountable to the promises you make in government. Which is also why there's going to be virtual parliament coming back. Just thought I'd touch on that.
Yeah. There's enough detail about it.
Yeah.
A name. That's it.
Yeah. But I think it's going to be very difficult for. I think it will be very difficult for Matt Hancock if he doesn't manage to fulfill the targets that have been set by the government.
Even if he doesn't, though, you can say that he's not been trying to. I think he's actually been doing pretty well throughout this whole thing. All in all, I think that yes, he's had his ups, he's had his downs, but I think that as far as it goes, for someone who he's managed to cope with, a lot of pressure and a lot of things like that, and actually he's managed to do incredibly well with it.
Well, I don't think you two are ever going to agree on his performance. But the thing with testing is once you have tests, the next step is contact tracing. That how do you, if you have tested positive, how do you go through and tell everyone that you've been in contact with in the last week or however long?
There are systems in place. I can't remember which country it is. I want to say South Korea, but I'm not sure.
South Korea has done very well. So
they have done you get a text with everyone who's tested positive in your local area where they were.
So what happens is you have tests, you put your phone number in there, they will then trace back in the infection period all the phone records of where you were, triangulated using reception towers, and then get that list of all the numbers and then send them a message going, get yourself tested.
But the NHS Digital is developing an approach based on Bluetooth that won't know where you are, or that they say they won't know who you are.
That can work on a wide scale.
Why do you not think it'll work on a wide scale? Because it's clearly worked and working in South Korea.
So
that's a different approach.
I'm talking about the method in which they're collecting the information won't work. You can't use Bluetooth for something like.
Oh yeah, no, definitely not. I think the current approach is.
I think it has to be centralized. So I do think it has to be based off telephone networks. I think it's the most accurate way. You can measure it within a few meters now. So
I think it is the only way that you can do it. It's
unless you had a based off Wi-Fi.
I think Bluetooth is it's a central app that not just you have it yourself on Bluetooth that contacts people, but it keeps in contact using Bluetooth who you're near. You have the app.
But the thing is, so I never have Bluetooth on my phone, and I know loads of people who don't.
I think it would. Well, part of it, Apple and
If I was going out and I didn't want people to know, I just turn my Bluetooth off and done. So it needs to be based off some centralized system.
Talking about building it into both iOS and Android, not Apple and Android, Apple and Google. Are talking about, and so I'm sure if they built it in, they might have the option to force Bluetooth on.
well,
I mean, they wouldn't. The tech side of it.
I think the reason why the Bluetooth thing would be a problem, I think it's problematic that we're not using like Google's data of where people are. We're trying to develop our own.
Google has now been licensing out that data. Actually, it is now freely available on the internet for most of their users.
Yeah, but what I'm saying is instead, why aren't we using Google's data? Because Google have already collected, large amounts of data on everyone, rather than trying to develop our own system for solely the NHS based on Bluetooth.
I think we should use the tech platforms that are currently develop things to backtrack it. But I think going on, it should be a centralized system. So centralized through those telephone networks, because it is the most reliable and the easiest option of doing it, I'd say.
Yep,
but that's not the way the UK government intends to do it. So we'll see if they change their mind and make a U-turn on that. But
yeah, so I think there's not really much more to say on the exit strategy at the moment.
No, they haven't announced enough.
Shall we talk about some more specific members of the government, being Matt Hancock and Priti Patel? George, would you like to? Or George,
yes.
Would you like to enlighten us?
I think we've some already. With Priti Patel, I think she's finally come out of wherever she's been during the crisis, and she gave a press briefing. I think it'd be described as contemptful. For me, I think briefing that she gave at Ulster, and I think it highlighted the disarray that I think also the government are currently refusing to apologise to.
So, George, you're breaking up, I'm afraid.
Yeah.
Internet is a bit bad,
yeah.
But it's been. I think the press briefing that Priti Patel did was one of the worst briefings we've seen so far. I think it sort of hit its peak when she said, "I'm sorry that people feel that way," rather than apologising for government strategy. And I think the one thing that the government has failed to do so far, which is admit mistakes when they made them, rather than try and defend it.
It's not her job to apologise. She's not going to go against the government's strategy unless the government say we did that wrong. I think that would be completely. I don't think you'd ever see any political party member ever do that.
However, I don't see what's wrong with them just going, yes, we haven't been perfect during a global pandemic. We will improve for next time. What's the problem with saying sorry? Like, she should have just. It made it sound so awful for her avoiding the question.
It's not her job to be saying that.
Well, she was standing at a government press conference representing the government, so.
If it's not her job to apologise for failed policy, then whose job is it?
I think that has to come from the party as a whole, or the leader of that party, in this case, the Prime Minister.
It wasn't
probably
over PPE though, which isn't her field.
Yeah.
being covered by the Home
That is
Office, or
true. I
Because
don't. PPE wouldn't be
PPE I
covered by
thought
that.
would be, yeah. I don't really know who's in charge of PPE because she hasn't been seen for. You'd think she's some lowly junior minister. She's Secretary of State for the Home
Yeah.
Office who appeared during the biggest crisis at home
Yeah.
that we've had for a long time. So
I think Matt Hancock, I think, has also been when he did one of his ones, he was very quick to dodge questions about PPE and deaths of NHS staff. He tries to like palm it off to the sort of scientists either side of him.
but then I
which
think that's what he should be doing in that regard. You know, if he doesn't have the figures and they do, then he should allow them to take it. It's not his.
was it
like,
more the
they have
government
the two other
saying
people
it's
there.
sorry and people shouldn't be dying? Is it more? Was it did they want the political or did they want stats and numbers?
It's more they wanted the political. They wanted an acknowledgement that the government hadn't managed to get PPE to everyone on the front line, and that they wanted answers about why and what they were going to do and whether or not they would apologise to NHS staff who hadn't had the right equipment.
I think that is a very harsh statement. I think it's something that's very hard to blame Matt Hancock for. But when these people go out, they have specific things that they're almost allowed to talk about, and if that's not in his reign, I don't think we should be judging him.
I disagree. Sorry, Stephen, I have to disagree entirely. He's going representing the government as a health secretary. He must have expected PPE was going to come up as a question. It's not like he wasn't briefed on it.
I think, but I think with the PPE, it's such a wide kind of wide topic, and it's one that has been acknowledged many times because the government, by saying we're getting more PPE, have acknowledged that there's a lack of PPE.
I think that is true, but there's sort of getting the PPE, but then there's also getting it to the right places as well, which I think is currently being a failure of the NHS system.
That's the NHS. That's up to them of going, we have this PPE, where do we need to send it? I think that's more to do with the running structure of the NHS than anything else.
I think that links on to what we're going to say later, but the NHS is essentially government run.
Yeah, but also the one thing that I heard this morning on, I think it was Good Morning Britain, was the fact that they've taken VAT off of PPE for the NHS and NHS workers, but what they haven't done yet is currently taken off any VAT for care home workers. So care home workers, if they want to have PPE supplied to them, in order so that they don't get infected, but they also don't infect the elderly in care homes. One figure that was used on the program was that they had 6 people employed, and for a week's worth of PPE, they had to pay £8,500, which is entirely unsustainable. And so I think that I still think the government is not doing enough in order to get that distributed.
I'm not disagreeing that they're not doing enough, but I think it's hard as well for kind of stands by people not in the internal structure of the government to know why that's the case. I agree that we should be getting PPE to anyone and everyone, but there are reasons beyond our knowledge, I'd say as well, as to why that's not happening.
I think the government kind of need to do a better job of explaining it, because I think like initially there was when it was still quite a novel thing and people were still kind of getting used to it, and it was like, oh wow, look what's on the news sort of thing. I think then people were much more sympathetic to the idea that this is a really big out of the blue kind of crisis, and wow, the leaders kind of stepping up and kind of taking us forward. But I think over time, as as other countries have started to deal with the situation quite well, and they've had low mortality rates and high testing rates, PPE getting sent out everywhere. I think as other countries have started to do well like that, and we might be able to spring up loads of hospitals all over the country, which is like massively impressive. I used to think that's just a kind of Chinese thing that they did. But then when there are things like the basics, the PPE, the testing, which are not being spread around the country like they should be, then I think the government really needs to kind of explain why this is and be more open than they have been recently
I do agree
as
with
to
that.
their failings.
Yeah, certainly. I think before there's too much discourse between the left and rights of our of the panel here, shall we go on to something a little different? Shall we be talk? Let's go on. I'd quite like to talk about Donald Trump and coronavirus for a minute here.
I mean,
Which is an
his.
interesting one.
I mean, we can bang on about what we've done all we want, but at least we're not America.
Yeah.
His response has been absolutely woeful. You know, in February all the way through until very early March, you had Trump and a lot of media like Fox News going, "Oh, this isn't going to be a big thing. We've got no infections, no deaths. Everything's going to be fine. It's basically a hoax by the media to scare you all." And now they're digging mass graves in New York. So it's been a very, I think it's also been a very mixed response in America, depending on which state you live in, because the state have a lot of power over what has to be done. But I think America has a bigger problem than us. I think the biggest reason for that is they don't have a nationalized health service that's free at the point of access, and so any testing that needs to be done, they'll have to be paid for, which means you can't correctly track the amount of people who have the virus, because not everyone's going to get tested because not everyone can afford it, and so it's
one of the things they did.
It's
You're infected isn't, but being tested is free.
Yeah, but it's just it's taken them. It's been a very slow response from America.
Certainly.
And I think their measures are subpar to where they should be.
Yeah, I don't think there's anything about that. I mean, I do think it's interesting to kind of see. Of course, America kind of took what we attempted to do to the extreme. You know, we were kind of thinking, can we kind of achieve this balance faster by not putting in as many measures? And America did not realise the massive consequences that may well have in the future. That future being now, and really come back to haunt them.
Well, I think the problem also with Trump is he doesn't understand basic science that we all learn in like year 8, which is antibiotics don't kill viruses.
Yeah.
And it isn't because the virus is too clever or too strong, as he keeps saying. It's because antibiotics do not kill viruses. And it's so disheartening to see him whenever he's at any point giving a press briefing, because like I think there was I can't tell for America if it's today or yesterday, but he gave a press briefing and he was asked to justify many of his actions, and he just turned the press briefing into essentially a propaganda wheel.
He basically did a sizzle reel. He did a sizzle reel, basically going, "Look at all these politicians saying, a great job, a tremendous job," as he would probably end up saying.
So when this came up in our discussions about what should we talk about, I said, is it news that Donald Trump isn't very smart, clever, intelligent? So he's tremendously, hugely I don't know. I've forgotten what I was going to say. I must be doing an impression of him, but yeah.
No, you'd never do that.
No. Coronavirus isn't caused by the mainstream media, nor can you blame it on them. It's your job.
Yeah. I mean, let's just kind of talk about let's just kind of talk for a minute though about the kind of American political structure, because it is harder for, I think, America to actually do some of the things that every other country's been able to do because they don't have states and they haven't had it's a federalized system. I think that is one of the big issues with it. Because he's not. I don't know if he can even issue an executive order centralizing lockdown.
He says he can't because 8 Republican states with Republican governors still haven't issued stay-at-home orders, and he said he can't overrule them or force them upon them.
Although at the press briefing yesterday or today, depending on when it is, what time it is in America, he said that he was seemingly all-powerful. I'm going to try and get that up. Which was,
he's contradicted himself on it. He says that he seems like he has the power to lift stay-at-home orders issued by state governors. He can't introduce them, which seems to be nonsensical.
Yeah. I don't think some of the ways that the US states have implemented them is incredible. I think my favourite one of these is the Louisiana incident.
What happened in Louisiana?
They played the purge siren.
Oh dear.
They belted it out. The police belted it out in Illinois, I think it was.
Oh my god.
And the amount of tweets that people put out going, I was just awoke from a nap to hear the purge siren in a dazed state. What is happening? And I think the police are now claiming they didn't know it was the purge siren. So I'm not quite sure what's happening there.
Talking about the structure of the US, an interesting thing I saw was in 2 different areas of the US, in the northeast and then on the west coast, groups of governors are joining together to coordinate when they're going to lift restrictions, almost as if states could work together and elect a single leader that was in charge of all of them in some way so they would be united. It's a very foreign concept, but yeah, that's what I'm saying is that how I do note these are democratic governors seem to be essentially setting up separate systems to make decisions.
I think there's a difference between coordination though and having it several ways. That's an agreement that they've all reached. Going, we're all in the same area. It's going to affect all of us if this goes bad. If we lift lockdowns at different times, that's going to go really badly.
But it affects everyone in the US. It rightfully should be federal, but states are using their rights because the government.
I completely agree, but I think that's something that
have to do it themselves.
We don't. I don't think we have the exact information on whether or not Trump can even centralize these particular things.
Yeah. It seems like he could issue guidance, but they just ignore him. The ones who don't follow.
I believe Texas is looking at lifting their restrictions.
Oh no.
I think they probably think they have guns, so they're fine.
Of course, it's Texas.
Yeah. As long as you've got a gun, you can shoot the virus out.
But we're just going along the stereotypes here, just to clarify.
Yeah.
It's. Oh my god. I'm really glad. It's that's the problem with talking about America, is it makes our government look fantastic. Our government isn't fantastic, but at least it's not Trump. It's the.
I still think that our government's doing they may not be doing the best job, but they are certainly most definitely not doing the worst job.
No, they're not doing the worst. I think the worst has to go to Brazil, but there we go.
Yeah. I think having the NHS is kind of a real bonus as well, because even when the government might make mistakes, having a strong, sort of robust health system just gives them a little bit of cover. Whereas in the US, mistakes are mistakes, and then when you haven't got any sort of coverage, when the healthcare system is the way that it is, then you're kind of doubly screwed.
Yeah. Thank you, Tom, for bringing us nicely onto our next topic. Not sure if that was planned or not.
Oh well, yeah. Been natural, I think.
About the NHS. We were more specifically talking about funding for the NHS, and whether or not it's right for people to donate funds to keep it going, or to bolster their capability.
Is it that? Yeah. So I was the one that is it sets about. I somewhat feel that it sets a bad precedent that if the NHS is to be viewed as a charity, I'm not saying what the NHS doesn't do is charitable or for the public good, but that it's so essential they shouldn't have the fluctuations of funding that come with people giving when they have money. It should come from the government. It's the government's duty to ensure we are to look after us, not based on whether rich individuals do or don't want to donate their salary from playing football to the NHS.
Yeah.
I think that it isn't a charity, and it's a it is a public service. But if people feel that they want to invest in public services, I don't think there should be anything to stop wealthy people investing their money in public service. And I think
One issue though with that is that people are going to be then going, oh look, look how good I am. I put extra money towards the NHS and things like that. And people may well then go, well, if I was going to pay tax on this thing, I'll just put that money towards the NHS instead. Then I know where it's going, which isn't how the taxation system is meant to work.
Well, I think the reason why people currently or footballers are being asked to donate money towards the NHS at the minute is because we aren't putting enough money in the NHS, or enough money hasn't been put in the NHS in the past few years, and the tax system.
But let's put it in perspective. Let's put this in perspective though. The defence budget currently is a quarter of that of the NHS's budget.
Yeah, but that's because defence, we currently don't have any countries we're war with. I don't think we're not gonna currently we're not going to be invaded, but we are at the minute in the middle of a public health crisis, and the NHS I think is extremely important to keep people healthy, so that you can keep people in work, so that they can will contribute to the economy.
Yes, probably one of the most funded elements in the UK, if not the most funded.
It is one of the most funded or the most funded. However, that doesn't mean it doesn't need more money invested in it.
I'm not saying it shouldn't receive more money. I think we can try and leave that issue out of it. It's whether who decides the money it gets. I think it's right if individuals want to pay more tax to support public services, they can pay more tax, but the government should decide how and where the government budget is run. And if and it can go into the central pot to get divvied out. And so yes, the NHS probably should receive more money, but is it right that comes from donations and it operating as a charity?
Well, I think if it operates as a charity, it should be a registered charity.
I think the NHS does it receive donations? Does it take donations?
I'm not sure on the.
I mean, I think the NHS has various different charities.
The NHS is a brand. It's made up of hundreds of organisations. Like you can donate money to Great Ormond Street Hospital. That's a well-known one. I know people donate lots of money to Great Ormond Street because they run as a charity and get some funding through the NHS. But
okay, so I just found it. So NHS charities are internal to the NHS, but they're a trust. So they don't have any legal power behind them. If that makes sense. So they're not a legal entity. It's just a trust. So it's just almost a way of a separate bank account almost, but with set funds, and this is what you can spend it on.
Okay.
I believe that's the loosest possible kind of explanation.
Yeah.
Putting it.
It doesn't matter the specifics. It's more the more is it right that people were it was just, it seemed to be I know it's a bad argument, a suggestion to a slippery slope that it shouldn't receive the same funding year to year, which it should.
I think certainly targeting people who have high incomes as, you earn a lot, so you should donate to the NHS. I think that shouldn't be. If you should donate, I think you should be able to donate to the NHS, but I don't think that should be the argument for it. of, oh, you earn a lot of money, therefore you should donate to the NHS. Because if you earn a lot of money, the taxation system should take into account that you earn a lot of money, and therefore take more money off you to give to the NHS or other
Let's not
public
get into
services.
taxation politics here, because that could go on for quite a while.
but I think I think there should be sort of charities or the trusts within the NHS, so that if you want to, you can give money to the NHS or give back more to the NHS. If you feel like, I think especially it's key of people who have taken a lot out of the NHS. But by taking a lot out, I mean the NHS have they've used the NHS as a public service, and the public service has, you know, done really well for them. You know, for example, people with or family members who have had cancer and have been taken care of in the NHS, and the NHS do a fabulous job of pretty much most things that they do. And so if people feel like they want to give to the NHS to help support those sort of things because of the work the NHS does, I don't think there should be anything stopping people from being able to donate more money to the NHS. But I don't think it should be something that's seen as a sort of, oh, you have loads of money, therefore you should donate more to the
Well, I
NHS.
think that's inevitable, though.
Well, I don't think it is, because there is a trust system for the NHS currently, and I don't think it's being used as you should donate loads of money to the NHS. I think the only reason we've got that at the minute is it's really difficult to not talk about tax. I think the only reason we haven't got that at the minute is because we have got a tax system which doesn't fund the NHS properly.
It's a
But
football
I think we can clearly see that it is funding the NHS very substantially.
that
Fun-
does.
It's funding it substantially, but not enough in my opinion. So-
Agree to disagree on that. The reason this has come up is that it seems it's not just the wealthy. It's targeted entirely on footballers. Everyone that they keep on getting hit by, they should be giving up that whilst non-playing staff are being furloughed on the government furlough scheme, that they are being paid, and they should donate their money to the NHS.
I think firstly it's wrong for clubs to be furloughing non-playing staff. I think that's ridiculous, because I think they have far enough money in order to pay the staff that they currently have, without it being taken from the public pot. But secondly, I don't think that that there should be calls for footballers to donate a load of money to the NHS, because again, taxation takes you pay what the government thinks you owe to society through tax, and the rest of your wage that you have is your money. You know, you've got a job, you've earned that money, so therefore
I think
it's then up to you
it's
what to
partly
do with
though,
it.
George. I think what it is partly is that these people are, in many people's eyes, being paid a disproportionately amount more, and therefore they should be contributing in this time far more to the NHS. Personally,
Well, the thing about it is though is it's the people who watch football, the people who then demand they want to watch football, they buy Sky in order to get it. They're the ones who are creating a demand for these people to be paid the amount they are.
yeah.
And so it's as soon as you start going, because I could start
I
saying,
completely agree with you, by the way. Here, I was just kind of trying to force the.
I'd say Amazon should currently be paying, half of, or all their profits should currently be going towards, in the UK, should currently be going towards the NHS. It's like, no, because it's a private company. It's almost the same thing with footballers. It's a private wage. It's like if you got, let's say, lawyers who make quite a lot of money.
I'm sorry to interrupt, but why do you think I'm kind of being devil's advocate here, but why should non-playing staff not be furloughed when there's no football is happening and they are a private company? They have a legal obligation
still
to
having to
shareholders
work
to make
because they're having
money.
to keep themselves training, and they're having to keep themselves fit, which is effort behind the scenes that we don't see. Why then? But these people, that their jobs are not ongoing in the same way. They don't need to be there currently, so they should be furloughed.
I think
I'm
some
trying to continue
clubs
on.
as well, even in the Premier League, some of the ones who are smaller don't have the massive amounts of money that some people think they have, or at least the major clubs have. And so for some, it is going to be a battle for survival. Like some of them are hardly breaking even, kind of throughout the season. So when they have a long period off like this, they could also be quite negatively affected.
Yeah.
I
Just
think
like, really quick, I'm just going to put a pause in this conversation for a minute because it has just been announced that the UK death toll is at 778 currently, in the last 24 hours,
778.
which is a
That-
small rise.
That is a small rise.
It's a really, it was most recently 717 or something like that.
It's a
That-
small rise, but it's not quite as big as up near 1,000 a day that we were
Yeah.
seeing.
I just wanted to pause the conversation for a minute there
Yeah.
because that's literally just come in.
Okay, nice. But yeah, it is a small rise, but it's still, the trend does still seem to be heading downwards. But we'll see.
Just quickly,
I think
we only
the
have-
the 778 I think is an increase on yesterday's total, so it's like more than that per day, but it's just 778 more than there was yesterday.
Yeah, it's the increase in the 24 hours. Yeah.
Mhm.
Just something because we only have a few more minutes left. I just wanted to jump on kind of a little fact that I found quite interesting a few weeks ago, which actually goes back to what George was saying about Amazon just now. And Jeff Bezos has set up a GoFundMe page, I believe, or something similar, to pay the employees of Amazon more during this time.
Interesting.
That's a very.
I hope it's a
scary
major
move.
contributor to the.
I don't think he's put anything towards it as of currently.
Oh dear.
I think Amazon has increased their staff's wages by something like 10% already. So that would come from the company's money, which is mostly
Yeah.
his. But
Yeah, but I'm not gonna lie, Amazon are not short on money. It's money. Money is not Amazon's prime concern. Well, actually,
That's just-
it is their prime concern, but
yeah,
they have far enough of it to not be starting GoFundMe pages. I don't think it's quite as bad as Branson asking for bailouts of public money.
Oh yeah,
but,
that was bad.
that was really bad. But it's just dumb. It's really dumb. You have the money.
Yeah. And on that note, that's very, very dumb note.
Very, very dumb.
We'll leave it there. I believe, hopefully, if there's more information, we'll be talking about virtual parliament as one of our topics next week. In the hope there's more information. I'm sure there'll be plenty more news in the COVID-19 area, and hopefully less talk about taxation. So thank you to we're sure many hundreds of thousands of viewers currently. Thank you guys for all being here. And yeah, see you guys next week.
Cool.